In the annals of medical history, certain tales persist, not just for their drama, but for revealing the brutal architecture of early progress. One such story, the, quote, 300% mortality surgery, stands as a stark testament to an era before anesthesia, before antiseptics, before even rudimentary understanding of infection. This wasn't merely a dangerous procedure, it was a desperate gamble against agonizing pain and almost certain post-operative death. Our narrative centers on Robert Liston, a Scottish surgeon renowned in the early 19th century for his incredible speed with the scalpel. In an age where surgical skill was measured by mere seconds, Liston was a titan, his operations concluded at a dizzying pace. Imagine a dimly lit operating theater, filled with the stench of unwashed bodies and fear, rather than antiseptic cleanliness. Spectators, often students and curious onlookers, would gather to witness these brutal spectacles, learning by observation. Our specific tale recounts a leg amputation, a procedure of immense gravity, performed under excruciating conditions. The patient, likely a desperate soul suffering from gangrene or severe injury, would be held down, often with sheer force. Liston's philosophy was simple. The faster the cut, the less suffering for the patient, and the higher the chance of survival. With a single, decisive motion, the scalpel plunged, severing flesh and muscle in an instant, a gruesome ballet of speed. The legend claims that in his haste, Liston accidentally sliced off his assistant's fingers, who was holding the leg. The assistant, perhaps shocked by the sudden pain, recoiled, bleeding profusely, adding to the chaotic scene. Liston continued, his focus unwavering, attempting to complete the ghastly task in record time, barely acknowledging the injury. Then, another unfortunate turn. A passing observer, perhaps leaning too close, found his coattail swiftly amputated. This second accidental cut added to the growing anxiety in the room, a testament to the sheer velocity of Liston's movements. The operation itself, a brutal and bloody affair, was reportedly over in under 2.5 minutes. Yet the immediate success on the operating table often masked a far more insidious enemy: infection. The patient, despite surviving the immediate trauma, succumbed days later to hospital gangrene, a common and deadly scourge. Tragically, the assistant who lost his fingers also developed a fatal infection, likely spreading from the unsterile conditions. The final, most peculiar detail of the legend claims the observer, whose coat was cut, died of sheer fright shortly after. Thus, the 300% mortality surgery emerged: one patient, one assistant, and one observer, 3 deaths from a single procedure. While the specific details of the observer's death are almost certainly exaggerated, the core narrative rings with brutal historical truth. This fable serves as a powerful metaphor for the terrifying reality of medicine before germ theory and modern surgical practices. Surgeons like Liston, despite their skill and intent, operated blind against invisible threats, primarily bacterial infection. The turning point arrived with the understanding of microorganisms, championed by Pasteur, and antiseptic principles by Lister. Anesthesia transformed surgery from a race against pain into a controlled, deliberate intervention, allowing for precision. Modern operating theaters, sterile environments, aided by advanced technology, stand in stark contrast to Liston's bloody stage. The journey from Liston's era to today's sophisticated procedures illuminates the profound impact of scientific discovery on human well-being. The 300% mortality surgery, though partly myth, endures as a powerful reminder of how far medical science has advanced, built upon foundations forged in pain.